The following segment is presented by Bremo Pharmacy.
Many medications can cause vitamin deficiencies, and if you're taking a cholesterol-lowering medication, you may be deficient in coenzyme Q, which is a very important nutrient for our bodies. Ann Anderson is here from Bremo Pharmacy, and we always count on you for great information, things we need to look for, and really highlighting all the great services that Bremo Pharmacy has to offer. I want to talk a little bit, before we talk about coenzyme Q, I want to talk about the importance of knowing our cholesterol numbers.
It is important to know your cholesterol numbers. If your cholesterol is too high, you don't have any symptoms. Sometimes the first symptom of too high cholesterol can be a heart attack or a stroke, and you want to find out before that happens what your numbers are.
Typically that would be a really good thing to not have to overcome a heart attack. Well, during the month of June, Bremo Pharmacy is actually offering a discounted panel screening of sorts for cholesterol screening.
Mm-hmm. It's a whole panel, like you said, of what your cholesterol is, what your BMI is, your blood glucose, your blood pressure, taking all those factors into account to determine what your risk of heart disease is.
And then you can come up with a plan to diminish that risk as well.
And to treat if necessary, yes.
Now, the discounted price on this panel is $20 for the month of June, so stop by Bremo Pharmacy on Staples Mill Road to get that done. Now, let's talk about the coenzyme Q a little bit and the depletion. If somebody's on a statin drug for lowering their cholesterol, what are some of the symptoms they might be experiencing if they do have this depletion?
Muscle weakness, muscle pain, memory lapses, difficulty concentrating, low energy.
Which is interesting because so many people might attribute those symptoms to aging or just being tired or things like that. So this could actually be signs of a deficiency in coenzyme Q.
Right, and it is something that does happen gradually. It doesn't happen immediately right when you start the statin. So sometimes it can be hard to associate those symptoms with the taking of a statin.
All right, so if we stop by Bremo Pharmacy, talk to the pharmacist, I'm on a statin, for instance, talk to them about this, what are some of the options we have to now replenish that coenzyme Q that's depleted?
Well, first of all, you want to stay on your statin because you need that for your heart health.
Absolutely.
To deal with the side effects that I mentioned, you can take a product such as Statinzyme, which will replace coenzyme Q. And in addition to replacing coenzyme Q, it also has ingredients such as fish oil and flaxseed oil and other ingredients that also in and of themselves are heart healthy, as well as dealing with the side effects associated with statins.
All that in one product?
Yes, and it saves money doing that so you don't buy all the separate supplements.
That is amazing. All right, we will remind you to get those numbers. Find out what your cholesterol numbers are. You can get it for a discounted rate this month, all through the month of June at Bremo Pharmacy. Get all the details at bremorx.com.